The colonoscopy itself, that's the easy part. You're asleep, you don't feel a thing. But the colonoscopy prep, that's where people panic. And here's what's wild. There's one mistake almost everyone makes it with their colonoscopy prep that tanks the whole thing. I'll tell you exactly what that is in a minute. If you've ever talked to anyone who's had a colonoscopy, the prep is the only part they warned you about. But most people make it way harder than it needs to be because nobody actually explains it clearly. They hand you a packet from the pharmacy and say, good luck. Not today. I'm Dr. Zaid Fadul. If you watched my last video on colorectal screening options, you already know why getting screened matters, especially now that the recommended screening age dropped to 45. If you just turned 45 and you're staring down your first colonoscopy, this video is for you. The number one question I get is, how bad is a prep really? Today, I'm walking you through exactly how to survive your colonoscopy prep, step by step, from a week out to the day of. I'll break down the 5 most common prep drinks, give you real colonoscopy prep tips backed by clinical trials, and share the things nobody tells you before your first colonoscopy. And real quick, if you're watching this the night before your colonoscopy in full panic mode, skip to the chapter called Taste Hacks right now. I got you. For everybody else, let's start from the top. First up, the 5 colonoscopy prep options your doctor might give you, and one of them isn't even FDA approved. One of these 5 preps is not FDA approved for colonoscopy, and it's one of the most popular in America. I'll tell you which one. According to the 2025 U.S. Multi-Society Task Force on Colorectal Cancer, no single colonoscopy prep has been proven better than the rest for the average healthy adult. Your doctor picks one based on your health history, your preferences, and honestly, what your insurance covers. Here are the 5 most common. Number 1, Go Lightly or Colite. The OG, 4 liters, that's a gallon of salty liquid in 2 split doses. It works well, but tastes like shit. With 87 to 90% adequacy, but high volume preps like this have lower tolerability. Only about 2 out of 3 patients say they do it again. If you've heard horror stories, this is usually the one. Number 2, Miralax mixed with Gatorade. Here's the one, not FDA approved for colonoscopy prep, but it's one of the most widely used in the country. You dissolve 238 grams of Miralax into 2 liters of a sports drink and split it into 2 doses. In a real-world study of over 4,300 colonoscopies, it actually scored higher on bowel cleanliness than Go Lightly, and patients tolerated it better. Now, you might be thinking, wait, not FDA approved? Yeah, your doctor can still prescribe it. It's called off-label use. Happens all the time in medicine. Totally legal, totally common. Number 3, Suprep or Sutab. Suprep is a liquid, 2 small 6-ounce doses, each chased with 32 ounces of water. Sutab is a tablet version, 12 tablets per dose with 16 ounces of water. These hit some of the highest marks, 92 to 98% adequacy, and about 95% of patients said they'd repeat it. Number 4, Clenpic, 2 small 5-ounce doses, each followed by a liter of clear liquids. Studies show Clenpic has the highest patient satisfaction of any colonoscopy prep regimen, with significantly less nausea and bloating. If you have a choice, this one's worth asking about. Number 5, Plenview. The lowest volume option, just 1 liter plus clear liquids split into 2 doses. Great for anyone who dreads drinking large amounts of anything. This is exactly the kind of conversation I have with my patients at Bespoke Concierge MD. We don't just hand you a prescription, we walk you through which prep fits your body, your schedule, and your comfort level. But which colonoscopy prep you choose is only half the equation. When and how you take it matters just as much, and that starts days before you drink anything. Let's review your colonoscopy prep timeline. Here's where I save you from the mistake that ruins more colonoscopies than anything else. But first, let's kill a myth. A lot of people think you have to eat like a monk for a whole week before your colonoscopy. Not true. The 2025 guidelines say dietary restrictions should be limited to the day before, only for average risk adults. That old advice about bland food for a week, outdated. 5 to 7 days out, if you're on a GLP-1 medication, Ozempic, Wegovy, Mounjaro, talk to your doctor. The general recommendation is to hold weekly formulations 1 week before the procedure, though this should be individualized based on your health. Also, check with your doctor about pausing any iron or fiber supplements. And start your shopping list. I'll give you the full colonoscopy prep shopping list in a minute. The day before, this is game day. But here's the good news. A low residue diet for breakfast and lunch is just as effective for bowel cleanliness as starving yourself on clear liquids all day. And you'll be way less miserable. That means white bread, eggs, plain chicken, white rice, pasta. After your midday meal, switch to clear liquids only. Water, clear broth, apple juice, white grape juice, tea, coffee without milk, sports drinks, popsicles, gelatin. One critical rule: nothing red or purple. It includes you, Thanos. Those dyes can mimic blood and compromise your doctor's view. At Bespoke, we actually send our patients a step-by-step colonoscopy prep guide with exact timing so there's zero guesswork the day before. That evening, begin your first dose of prep exactly as directed. Now, remember that one mistake I mentioned at the very beginning? It's about when you take that second dose. This next part is the single most important colonoscopy prep tip in this entire video. Okay, the number one mistake? People drink all their colonoscopy prep the night before and skip the morning dose. That one decision can tank your entire prep. Split dose means you drink the first half the evening before, then set your alarm, wake up early, and drink the second half the morning of, starting 4 to 6 hours before your procedure and finishing at least 2 hours before your arrival. Why does this matter so much? Split dose colonoscopy prep regimens produce cleaner colons, higher adenoma detection rates, meaning your doctor finds more polyps, and patients tolerate it significantly better. In one large trial of over 2,300 patients, the split dose group had dramatically higher willingness to repeat the prep compared to the evening-only group. I know, waking up at 3 or 4 a.m. to drink prep sounds absolutely miserable, but this is the difference between a clean colonoscopy and having to redo the entire thing. Set your alarm. All right, you have to drink it, but you don't have to white knuckle the taste. These next colonoscopy prep hacks are backed by actual randomized clinical trials, and one of them cut nausea nearly in half. One of these colonoscopy prep taste hacks didn't just improve taste, it actually made the prep work better. I'm saving that one for last. Chill it. Refrigerate your prep solution before you start. Cold dulls bitterness and kills the smell. The FDA and the American Society for Gastrointestinal Endoscopy both recommend it. Use a straw. Place it towards the back of your tongue. This bypasses most taste buds and gently reduces the flavor. Drink in steady portions, about 8 ounces every 10 minutes. Do not sip slowly over hours. It's not a beer. That just turns it into prolonged torture. Suck on a lemon or lime wedges between sips. Randomized trials confirm patients overwhelmingly preferred citrus-flavored prep. Adding orange juice to one prep type cut nausea from 59% down to 26%. And the number one hack? Menthol candy drops. Sugar-free menthol candies didn't just improve taste scores significantly in a clinical trial, they improved bowel cleanliness and reduced nausea. One hack, 3 benefits. I'll link some from Amazon. Bonus, use an opaque cup or thermos so you can't see the color. Put on a comfort show, something you've seen before that doesn't require focus. These are the exact colonoscopy prep hacks I share with my Bespoke patients before every colonoscopy. We want prep day to be as painless as the procedure itself. Now, before I get to the shopping list, if you've already had a colonoscopy, drop your best prep tip in the comments. What worked for you? Let's help each other out. Now that you know how to drink it, let's make sure you have everything you need. Quick shopping list, then I'm going to tell you the stuff nobody warned you about. Get this done early. Do not wait until the night before. Your prescribed prep solution, pick it up from the pharmacy days in advance. Clear broth, 2 to 3 cartons, apple juice, white grape juice, lemon lime Gatorade, yellow or green Jell-O and popsicles. No red or purple. Lemon and lime wedges plus sugar-free menthol candy drops. Soft, unscented wet wipes and berry cream, Vaseline or zinc oxide, a straw, an opaque cup, and a comfort show queued up. All right, you're stocked, you're prepped. You've got the hacks. But there's a handful of things nobody warned you about ahead of time. This next section is the real talk. This is the stuff your doctor probably won't cover in a 15-minute office visit, but you're gonna wanna know. You'll basically live in the bathroom. Expect frequent bowel movements starting 1 to 4 hours after you begin drinking. Clear your entire schedule. No errands, no plans, just you, the bathroom, and definitely don't forget your phone charger. Your stool should turn to clear or yellow liquid. That's the goal. That means the colonoscopy prep is working. Even if it clears early, finish all of your prep. Apply barrier cream to your anus before you start drinking. Trust me, I cannot stress this enough. You're going to be making a lot of trips. Your skin will thank you after visit number 10. You must have a driver. This is not optional. Most facilities will cancel your procedure if you show up without an escort. The sedation means you can't drive or take public transit for the rest of the day. You can drink clear liquids up to 2 hours before the procedure. That's per anesthesia safety guidelines. Don't suffer through dehydration unnecessarily. This is the biggest issue I see with all my patients before most tests where they should be fasting. They skip fluids and get really dehydrated. Don't skip water. That's almost always the wrong answer. The colonoscopy procedure itself is about 30 minutes. You'll be sedated, you won't feel a thing, and you'll wake up ready for a nap and a real meal. The colonoscopy prep is the hard part. And now you know exactly how to handle it. So here's your colonoscopy prep game plan. Pick your prep with your doctor. There are great low volume options now. Eat a normal low residue breakfast and lunch the day before, then switch to clear liquids. Always split your dose, half the night before, half the morning of. Use the colonoscopy prep taste hacks. Chill it, straw, citrus, menthol candy. Stock up on supplies early and lock in your ride home. Colonoscopy prep is not fun, but it's absolutely survivable, and it could literally save your life. Colorectal cancer rates are rising in people under 50 because of our consumption of microplastics, ultra-processed foods, obesity, and a sedentary lifestyle. Getting screened at 45 is now the standard recommendation, and it should probably start sooner. The prep is one uncomfortable day. The alternative is a cancer nobody caught. If you want a doctor who walks you through every step of this, from choosing the right screening to picking your colonoscopy prep to reviewing your results, that's exactly what we do at Bespoke Concierge MD. We take the time to build a personalized health plan around you, and we don't rush it. Check the link in the description to learn more and join the practice. Your future self will thank you. And if this video helped you even a little, share it with someone you care about who's been putting off their screening. It might be the nudge they need. Getting a colonoscopy is a great way to screen for and catch colon cancer. There are also several other ways to limit your risk of getting colon cancer. The video on the right breaks down the lifestyle triggers that are causing the highest rates of colon cancers. The playlist on the left covers colon cancer prevention and related issues in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.